Good morning, time now 6:22, time for Pet Talk this morning. We'll get to these cute little kittens coming up, but first we want to talk about something that's important for humans as well as pets. When you're going in for a medical procedure, anesthesia, it's a dangerous thing. It can be dangerous for both humans and pets, and we're talking about some things you want to keep in mind today.
Right, and there are certain ways that we can reduce the risk of anesthesia because the average pet, cat or dog, has at least 2 surgeries throughout their lifetime. So, these are things that are necessary. We need to get them spayed and neutered, and then they usually have at least 1 injury at some point. But the risk isn't as great as you think that it would be, and there's so many things we as veterinarians can do to minimize that risk. 1 in 100,000 pets are allergic to the anesthesia, but that's it. So, a lot of people would think that it's much, much higher than that, but it's not. Only 1 in 100,000 have a reaction to the anesthesia. But there are some things that we can do to minimize the risks.
And what kind of procedures do you need anesthesia for? I'd imagine not every surgery, but
most of the times when we go in and spay and neuter, we need to give anesthesia. When we do dental cleanings, which is something that Northwood Animal Hospital does a lot of, and we can't just say open up your mouth and hold still, so they need anesthesia for that. But things that we can do, and every vet hospital is different. You'll want to talk with your vet to see what they do to minimize the risk of anesthesia. But we do a thorough history on every pet before they undergo anesthesia, and this is because they could be on medications that might interfere with anesthesia. We need to know about this and minimize the risk. The other things that we do at the hospital is pre-operative blood work on everybody, because if there's liver, kidney issue, if they have diabetes, we need to know about that before we give the anesthesia and tailor the anesthesia to their pet. The last thing that we do at our hospital is put IV catheters on all patients, because this is our lifeline. If something does go wrong during surgery, we can get in there with some medications immediately and correct the problem. So it's actually very safe nowadays.
Yeah, and I'd imagine the best thing for folks out there concerned, just talk to your vet. Is that kind of the advice?
Exactly. It's really good advice. I know some vets give the pre-op blood work as an option, and I highly recommend people to take them up on that option, because it's going to help minimize your pet and possibly save their life.
Well, before we cut you loose, we have these 2 adorable kittens that are up for adoption. And what peaceful little kittens they are. Unnamed, they're both boys.
They're both boys from the same litter. They're about 9 or 10 weeks old, and they're available.
This little guy. What a peaceful little kitten. Oh my.
They're up through adoption at Benzie County Animal Shelter. So you can call us or you can call Benzie County. And if you're interested in a cat, these are 2 mellow kitties.
2 mellow kitties.
Yeah.
Well, Northwood Animal Hospital as well. You can contact them. Jen, thanks so much for coming in today.
Thank you, Brody.
Let's turn things over to Joe Charlevoix with weather.